Hey everybody. So today's video blog topic is on more of the kind of business and financial side of medicine. I'm going to talk a little bit about health insurance and some of the kind of lingo or terms that are associated with that. So the first term is going to be premiums. So premiums are the amount of money that you spend every month to your health insurance company to have the insurance. So sometimes you are paying all of the premiums yourself. Sometimes if your employer is providing insurance, they're paying it all. And sometimes you are splitting the cost between you and your employer. But this is the amount you pay every month to your insurer, whether or not you see the doctor or have any medical treatments. The second term I want to talk about is called a copay or a copayment. So this is the amount that's specified by your insurance plan that you need to pay to go see the doctor. And different types of doctors can have different copays. So a lot of times seeing a primary care doctor has a different copay than seeing a specialist, like an ENT like me, or any other specialist. So, we sometimes get patients who are surprised that they have to spend more to see me than they would seeing their general practitioner. And that's just because the copayment for a specialist is higher. So what does a copay get you typically? So in all cases, the copay will pay for, an evaluation with the doctor, talking to you, examining you, and, providing some sort of treatment, whether that's a prescription or advice or whatever it might be. A copay does not necessarily cover any procedures or tests that are done in the office, though sometimes it does. So this is where things get tricky. So that's what a copay is. So the next term I want to talk about is called the deductible. So deductible is basically a set amount of money that you as the insured person has to pay in each calendar year before the insurance starts to help pay for things. So usually patients who pay higher in premiums have a lower deductible. And patients who have lower premiums per month have a higher deductible. So they kind of get you one way or the other. But the deductible is, it's used sometimes for actual doctor visits, sometimes for procedures or tests or various things. And basically, for your deductible, you're kind of paying out of pocket until you reach that set amount for the year, whether that's $500 or $5,000 or anywhere in between. So that's kind of what the deductible is. Sometimes, depending on your plan, you may actually have to pay towards your deductible just for all of the cost. So the doctor's visit, any tests or any procedures. Other plans, you may pay a copay for the office visit, but then have to pay towards the deductible for procedures or tests during the visit, or for surgeries or anything like that. So again, it's complicated, and it depends on your insurance plan as to what you pay. So the final term that I want to talk about is called coinsurance. And coinsurance is basically refers to after a patient has paid their entire deductible for the year. And after that, how much does the insurance company pay versus how much do you pay as the patient? So sometimes, let's say someone has $1,000 deductible for the year. So they go to the various doctor visits, they get some tests and procedures, and after a few months, they've paid their full $1,000 and they've met their deductible for the year. So at that point, this is when the co-insurance kicks in. And so different insurance plans have different specifications with this. So sometimes at that point, the patient will pay 20% of the cost and the insurance company pays 80% of the cost. That's a common one. Sometimes it's 70-30, sometimes it's 90-10. Again, it just depends on the insurance plan. And so the patient will continue to pay some amount towards care, but the insurance company starts helping. And then eventually, if the patient continues to pay enough, there's eventually typically an out-of-pocket maximum for the year. And once the patient's met that amount of money in a given calendar year for the plan, then the insurance company pays 100% after that. So that's really, those are kind of our insurance terms. There's the premium that you pay every month, There's the copay that you pay when you go see the doctor. There's the deductible, which is the amount that you have to pay yourself each year before the insurance company starts to help. There's the coinsurance, which is after you've met the deductible, how much does the insurance company pay versus how much do you pay? And then finally the out-of-pocket maximum, which is the total amount you're stuck with in a given year, if you use a lot of medical care. So yeah, it's complicated. I had to learn a lot of this stuff after residency, now that I'm in private practice. But I hope that helps a little bit at kind of understanding, the next time you go to the doctor's office, what's going on with your bills. So we'll talk to you soon in the next video. Bye.